Hip and buttock pain is one of the larger diagnoses that we take care of here at Balanced Physical Therapy. What I'd like to impart to you with this short video is the idea that your hip doesn't exist in isolation. It's a very, very large, very stable joint localized at the center of our bodies. As such, when you come in for hip pain, as many patients do, we're going to do a thorough lumbar spine screening examination, a sacroiliac joint screening examination, and a hip and knee joint examination, just to be certain that that particular body part is thoroughly seen as a segment within a larger system. Your hip does not function in isolation as a human being. We are bipedal organisms, meaning we walk on 2 feet. So the hip can't work by itself. It works in concert, of course, with your knee, your foot, your ankle down below, and more proximally with your SI joints, your other hip girdle, your other hip joint, and your lower back, your lumbar spine. Oftentimes people come in to clinic and they point to the outside of their hip and they tell us that they think they have hip joint arthritis, or their physician screens them briefly and sends them over with a diagnosis of hip pain, and we have the job of differentially figuring out what that hip pain is actually caused from. Hip pain can truly be hip pain. It can be arthritic pain, which is typically characterized by pain in our groin, believe it or not, and a lack of the ability to flex your knee upward, for example, towards your head, or bring your leg across the center of your body, or turn it inward. However, hip pain can also be referred to the hip from the lower back. It can be a nerve root impingement type of a problem, or a discogenic type pain. People have described sciatic pain referring to their hip girdle, for example. And although somewhat discounted recently, sacroiliac pain can also be a source of hip pain. So what is the sacroiliac joint? That is where our sacrum, the little triangular bone at the bottom of our spine, sits between our 2 ilium, which is essentially either half of our pelvis. Now, hip pain is very debilitating. As I said, bipedal organisms walk on 2 feet, so if you have dysfunction in one hip, you're going to have a limp, typically, in your gait. You're going to have the inability to squat effectively, get in and out of a chair, in and out of the car, on and off of the toilet seat, etc. It can actually affect every single part of your life. So, if you have hip pain, groin pain, buttock pain, lower back pain that sort of wraps around the side of your hip, or you can't lie down on one side or the other, or you notice significant difficulty walking up or walking down a flight of stairs, I really encourage you to come to Balanced Physical Therapy, have a thorough screening examination, or visit your local physical therapist and make certain that if you're going there for hip pain, that you are also screened at your lower back, at your pelvic girdle, and at your knee, and even perhaps at your foot and ankle, to make certain that your entire movement system is being cared for so that, again, your function can be optimized.